So this was, minimal residual disease or measurable residual disease. These are concepts that are used in hematologic malignancies to try to define the response to a given therapy. And that is, a concept that spans across different diseases. So this was a number of different speakers focused on different diseases. So, chronic leukemia such as CLL, multiple myeloma, or even acute leukemia such as ALL, all had speakers talking about the role of MRD testing in those diseases, which is much more established than it is in lymphoma. My job was to sort of give us an update about where we are in lymphoma as we think about MRD. And a lot of this has to do with some of the things I just touched on. In lymphoma, the biggest difference is we're usually measuring these types of things from cell-free compartments of the blood. So instead of directly measuring the tumor cells, which is done in these other diseases, in lymphoma, we're typically measuring from plasma or the cell-free DNA in the plasma. So in that context, I was showing some data, some older data, some mature data about the potential role for that. This is an opportunity to monitor patients during therapy or even at the end of therapy and see if they really, have undetectable levels of ctDNA, because those patients do much better than if they have residual levels at the end of treatment. And I was also showing some newer data that's been published, both in respect to sort of advances in the technology of some of these assays. There's newer technologies that can be used for genotyping these tumors, that they have, better limits of detection than previous models. So I showed some of that data. And finally, that you can apply it to other clinical situations, such as the use of CAR T therapy or other immunotherapy, and that early changes in ctDNA also looked like they were predictive of outcomes in those other types of treatments. So there's a lot of ways we can use ctDNA, and this was just sort of an annual update with kind of where the field is. And so I highlighted that in a very short 20 minutes about where we are and where I think we're going.